I do believe as a clinician, anything that can support me to deliver more direct care for patients is a big win. And I think there will be a lot of AI technologies that do help. At the moment, I think we went through this period of going from paper to digital. Some people still doing that now, like my trust. Which we thought, oh, that's going to make us more effective and we'll be able to see patients more frequently. It didn't really happen like that. We've had more burnout since we introduced EPRs. So I'm quite interested in how the next generation of EPR might look, and I've seen a bit of a glimpse with that from the provider that we signed a contract with. And it looks truly intuitive to use. It looks like it's going to be a bit of a game changer. I think it should release time to care instead of doing a lot of documentation, all the stuff that we don't really enjoy doing. We just want to see patients and do what we want to do. So that's quite exciting. I think if that gives us the gift of actually, I think, connecting with patients again, that for me is exciting, because I felt like as a doctor sometimes I was never able to give patients my full self, which is what I really wanted to do. And this is what we're talking about AI. We talk about AI, it's going to make us more efficient. That means that you just want me to see more patients for this sort of little time I've got. I don't think that's too exciting. It's quite exciting for the hospital because they make more money or get their backlog down. But as a clinician, I want to be able to give more high quality care. Sometimes that means more time with my patient to explain things, which they really appreciate. That real care element again. I know so many times I brush past people in A&E and quickly giving them results and not really explaining it fully because we don't have time. I feel like getting back to basics by giving us a bit more time to do that because we're so stretched and we're just getting more stretched and stretched. If AI can release more time to give that care, I think that's quite exciting. There's loads of different types of technologies that hopefully will help to get to that place. But that's quite exciting for me. Yeah, lots. But we need to make sure we know clinicians know how to use this technology as well, which is a pretty big red flag for me at the moment. Is that it's coming thick and fast, and clinicians in terms of their digital and data science literacy is probably quite low, generally. As I said, most of my consultants have been using paper for years. They don't understand the concept of good data input and how to actually make sure we can capture data so we can better inform our care that we deliver to patients. So actually training staff how to use these technologies is key, and at the moment I think we're still quite a long way about that. There's some good initiatives like the Clinical AI program, GSTT, it's countrywide now, is at the top of fellowship, for example, but generally digital literacy is quite low, and people don't really understand how these technologies can really affect them in the next decade, and I think that can be quite worrying because it's going to come very fast, so we do need to make sure we train the workforce how to use these. Otherwise, technologies can be used ineffectively or unsafely as well, so that's another thing that I'm very focusing on, also very mindful of in my space, but
You talked about power earlier. I think that's a really interesting concept in any innovation. And there's obviously potential for that power to be concentrated, etc. But again, if I take a parallel with fintech, so fintech initially promised much. If you think about where I was in the 90s and noughties, changing bank accounts. Actually, when I finished as a student, I had a student loan and a big overdraft. I actually lied. I said I was a medic and they gave me £5,000. I was doing English. No, my mate was lived with a bunch of medics. And I say, doing medicine, we'll give you loads of money. So I got loads of money. And then I was like, right, moved back home. I was like, going to transfer my bank account from my student account to where I was living. It took almost a year. And I was like, yes, they've forgotten the fact that I owed them loads of money. And a year, just literally, someone was telling me, but not true, if it's not done within a year, you keep the money, it's gone. Not sure. But the point is, compare that to today, where we are in terms of finance, ability to send money, receive money, etc., etc. And the point is, the power used to be with the banks entirely. You used to go begging to them for a loan. As a businessman, they had to go begging. Now that power dynamic has massively changed. But we've got to educate ourselves about it. So clean tech is my area. What I love about people who are engaged in the energy revolution is they suddenly feel empowered. You're not just getting a bill which fluctuates randomly, from month to month based on gas wholesale prices and all sorts of really weird stuff, and Putin involved in Ukraine. I've got solar and batteries in my house, I'm in control. And that's taking time. And now that's the early adopters, but that's the exciting bit, is that I think here, it's not just about time, they're exactly right. Time, what does time give you? Time gives you the ability to think. It gives you the ability to make decisions, to be creative, to actually start to go from being a passive consumer or advice from a doctor who who doesn't have enough time to really see you as a person, see you, or frankly is getting burnt out, to him or her feeling more empowered by having better knowledge, to you feeling that you're empowered but also having better knowledge. That's the exciting bit. And the thing is, that can sound like silly, starry-eyed optimism, but you've seen it in other areas. You've seen it in other areas where certain consumers and also the professionals are far more empowered. That's, I think, the exciting, it's not specific technology, but it's a social outcome, I think, is amazing.
There's something we haven't really talked about, which is, it's funny, in the past 3 months, every time I've spoken in public, I always talk about biohacking. So, and I find it, so when Samantha and I first met, the strategic focus for a lot of countries in Asia, Southeast Asia and South Asia was how do we improve wellness? How do we empower, educate people to be healthier, right? And that's really something that AI is doing very effectively. 5 a day as a campaign is one of the most successful campaigns in the world to get people to think. My cousin literally, he bases his nutrition based on 5 a day, right? And so there's a lot of stuff here in primary care and education that people don't really talk about. 30% of Indians has diabetes. Very easy to sort that out, with just an hour walk to some extent. Eating different things, but it's not about oil. There's so much stuff that can go in, and so we are getting so much more empowered to understand ourselves with the technology, and that's really that's fundamental, and it fits with power, because then the patient has power.
We're seeing this very early now. Patients are coming in and they're much more educated about their diagnoses or the treatment plans, which is only a good thing, in my opinion. Dilemma for us sometimes, because they sometimes know as much as we do, I feel like. So, we've got to be on our ball game at all times. But it's definitely empowering patients to take health into their own hands. It's only a great thing, right? That they know themselves and they can do it, as long as it's based on high quality evidence, and not nonsense. That's the most important thing. Evidence-based medicine, but empowering the patient to take matters into their own hand control.
Yeah, one interesting, just to take on that, is post-surgery visits, GP visits, hospitals always try to reduce those. And that's where this works very well. AI has helped a lot in terms of reducing and educating the patient post-surgery, so that they don't just keep visiting back again and again and increasing the costs. And that's where, because it's in control of the doctor to a large extent, and if there's some problem, then they can always connect to the doctor. And I've seen many successful cases there, and that will help your cause as well in terms of trying to how to make patients happier.